Hello and welcome to the first video here at Pharmacy Skills official YouTube channel. In this video, I really want to go over my top 5 gout tips. These tips will be useful not just in everyday practice, but they'll be very useful for those sitting the GPHC exam. It's also useful for anybody that's taken a course, a university level course that has a pharmacology component in it. But without further ado, let me get straight into the top 5 tips for gout. Number 1, remember, allopurinol doesn't treat flares. See, allopurinol reduces the production of uric acid, and because of the way that it works, the drug is not beneficial in relieving pain and inflammation when it comes to acute gout flares. Allopurinol is only indicated to reduce uric acid and prevent gout flares. So starting allopurinol or increasing the dose of the medication is typically not recommended, and it's not even helpful when it comes to reducing the things that are bothering the patient during an acute gout flare, which are pain and inflammation. To target the pain and inflammation, we need to use NSAIDs, steroids, or colchicine. Tip number 2, CKD awareness with allopurinol. CKD standing for chronic kidney disease. You see, allopurinol should be started at low doses. Typically, it's started at 100 milligrams daily or even less. And then it's titrated up gradually over 2 to 5 weeks based on the amount of uric acid that is inside the serum. This approach reduces the risk of gout flares and also improves tolerability for the patient. So, chronic kidney disease, however, even though it is something you should be watching out for, it is not contraindicated when giving allopurinol, but it does require that you slowly titrate up the dose and monitor the uric acid serum. So the goal serum uric acid is usually less than 6 milligrams per deciliter. Now, in patients with CKD, there is also a higher likelihood of getting some other side effects like a rash, Stevens-Johnson syndrome. This is especially true if you titrate the dose up too aggressively. This is why you need to go up gradually and start low. I also want you to remember that there is also an allele that makes it more likely that you will get certain side effects like the Stevens-Johnson syndrome. The allele is more prevalent in certain populations like the Han Chinese, Korean patients with stage 3 kidney disease or higher, Thai patients, and some African ancestry groups. CKD plus the specific allele, which is LA-B5801, greatly magnifies the risk of getting these side effects. Tip number 3, anticoagulation and renal disease. Now, flare management is very important. We tend to use NSAIDs most of the time, the first line when selecting a drug to treat patient inflammation. However, there are cases where NSAIDs should not be used, and you may prefer to use something like a corticosteroid or colchicine in such cases. The two most common cases to avoid NSAIDs are in patients who are taking anticoagulants for bleeding risk, and those who have pre-existing renal disease for fear of making it worse, because NSAIDs can make renal disease even worse. Tip number 4, thiazides raise uric acid, losartan can lower it. So thiazide diuretics increase uric acid levels and are common contributors to gout flares. So when possible, consider an alternative antihypertensive such as an ARB like losartan, which can lower uric acid. It's also important to note that managing risk factors can help in such cases. For example, the risk factors for gout are alcohol intake, especially beer, beverages high in fructose, red meat, seafood. These are all frequent dietary triggers. You can think of these as purine-rich foods. In the past, they've been referred to as king's disease because only kings and people who had high amounts of wealth were able to eat such foods. So addressing these contributing factors is just as important as your pharmacological therapy. Lastly, tip number 5, colchicine. Colchicine has a narrow therapeutic index and requires careful dosing, particularly in older adults and those with renal impairment. The preferred regimen for acute flares is a low dose strategy, which is equally effective and stays away from some of those nasty side effects that you may have when you give a higher dose, which won't even give much more of a benefit than a lower dose. The most common side effect is diarrhea, and this is one of the more common reasons why patients may not be compliant for the whole course. And lastly, with colchicine, think about major drug interactions, especially those with strong CYP3A4 or P-GP inhibitors. In other words, enzyme inhibitors. Things like your clarithromycin, your fungals like ketoconazole, and your antivirals like ritonavir. These drugs, these enzyme inhibitors can dramatically increase the toxicity of colchicine and should always be something that you're looking out for. This has been my top 5 gout tips. Now, if you found this information useful and you want to see more, please subscribe and comment below. Furthermore, we have a website, www.pharmacyskills.com, where you can find a large bank of questions and a large amount of video resources as well. I hope to see you guys in another video.